So as you mentioned, there's a bit of a turf war between the states and the feds about testing. But what we're really seeing in a lot of areas is a coming together in teamwork between the states and the federal government. How do you think that's worked out so far? And what would MGMA like to see going forward in terms of this sort of coordination?
Yeah, I think that, again, this is unprecedented, but you, I think we often forget. We think that the federal government can do everything, but healthcare is in many ways regulated at the state level. Licensure is regulated at the state level. We've been running into a lot of variation from state to state on telemedicine rules, licensure, and in the context of where a patient might be in one state. Like here, I live in Washington, D.C., and we have Maryland and D.C. and Virginia. And each state may have its own different rules with respect to licensure and other rules. Insurance is regulated at the state level, and so there are some things that the federal government can do to, especially on the front end, the type of thing where if you have the kind of the deep pockets to to deal with warehousing and protecting the country from such a large scale epidemic. But also, the way it kind of, I was thinking about when you asked that question about what you asked just a couple questions ago. We don't have a single payer system. Our system is incredibly complex given the nature of, there are dozens, if not hundreds of payers. Each state has its own rules in terms of licensure. In some states, nurse practitioners can do more than in other states, and yet they could be very helpful at dealing with access issues during this crisis. And so, I guess I would say that we have seen some coordination between the state and federal government, but I would tend to lean on the side that a lot more needs to be done, and this could be a learning experience, a terrible learning experience, but one that we need to remember in the future in order to make sure that our healthcare delivery system is ready for anything like this in the future.